Okay, welcome everybody. We'll let people come in from the waiting room here. Lisa Santora, are you here? Are you with us?
I am with you.
Okay, welcome. Thank you for being here.
Always with you.
We appreciate that. And I'm not sure if Mary Jane is going to be with us here today. Mary Jane, are you here? Okay. I think we'll just wait for another minute or so to get people in from the waiting room and we'll get started. Okay, I think we'll go ahead and jump in. Thanks so much, everyone, for taking the time to be here with us today for our second training on the public health liaison position. What we're going to do today, Melina, you can jump to the agenda for today, what we're going to cover. So what we're going to do today, like we did a week ago today, is just go over, Lisa's going to give us a little public health update, what's going on with COVID-19 in our community, and talk a bit about her team at Public Health supporting schools and contact tracing. I'm going to give a little bit of a overview of what we've learned so far around the public health liaison position, which we see as critical in terms of supporting the health and safety of our students, staff, and community. And then Lisa's going to go into a little bit more detail of the role of the position and what contact tracing is, defining what close contact is, which sometimes can be not totally straightforward. And from the public health perspective, it's helpful to hear how contact tracing is done. And then critically, the protocols when there is a potential or known exposure in the school setting. And then Melina Boyd from our Rethinking Schools team is going to go over some of the details of record keeping and how you can register as a liaison to ensure that you're getting updates from public health as they become available. So with that, I think I'm going to hand it over to Lisa. And as I think all of you know, or most of you should know by now, Dr. Lisa Santora is our Deputy Health Officer with the Marin County Health and Human Services and is a regular colleague over the past 5 months. We've been in pretty much daily contact. So thank you, Lisa, for being here and what you do every day to support our school community.
Thank you, Mike, and right back at you. We're in this together. Thank you, everyone, for joining us on this call. We believe this is the beginning. We know many of you have not served in this position as public health liaison, and this is our first orientation to how you'll be working with us. As everyone from the Office of Education can tell you, we learn together a lot of times, and we'll hear from you what additional training and information you need to be successful. And that's our goal, is to truly set you up for success and make sure that you have the technical assistance needed to get our schools open and to, most importantly, keep our schools open. We have, since I presented last week, just as normal in COVID land, things have changed already. We have a new blueprint for a safer economy, which was announced by the governor's office last week, which is now informing changes to the school environment in Marin County. We entered a new tiered system as a state, which is overall a very good thing. Marin County led the state in creating shelter-in-place orders with the other Bay Area health officers, and we are very proud of that work, but that effectively created a system where every county was standing alone and operating differently with different shelter-in-place guidance, et cetera. And with the introduction of this new blueprint for a safer economy, it creates a very defined tier structure. We're in the purple tier 1 structure right now, and we'll be moving into the red. We're anticipating to be moving into the red tier 2 structure next week, and I'll just tell you a little bit about that. But it creates a very defined framework for us to both plan for the reopening of Marin County, and also to prepare if we do regress in how well we're performing with COVID, our ability to control COVID-19 transmission, to return back to more strict shelter-in-place guidance. So I'll definitely make sure this is available and that can be shared with you. But right now we are anticipating tomorrow that we will be announced that we are entering tier 2, or the red tier, which is resulting from increased access to testing and reduction in case rates across the county, as well as reduction in the percent of people that are testing positive for COVID-19 when they test in our community. We now have more than 70,000 tests completed in Marin County. It makes us per capita the highest rate of testing per capita in the state, and that we actually are going to be getting credit for that. So our case rate is going to be adjusted downwards because of the work we've been doing to make sure that we get testing where it needs to be tested, and that's some of the focus we've had in the canal outbreak. We also are going to be getting credit for having an equity lens, making sure we've been equity centered in all of our work, which we have been from the beginning, and especially in partnership with the Office of Education. We don't know what that credit is going to look like, but again, making sure that we're providing service to our most vulnerable populations, especially low-income Latinx community members. And so that's something we're also will be looking forward to seeing. But effectively, with what that means is we're in a transitional space where, as of September 8th, a press release just went out minutes ago, which announced the first round of waivers that were approved. So there are schools that are going to be able to open in Marin County on Tuesday, September 8th, because they have received a waiver. They have completed a waiver that was approved by both Dr. Willis, the public health officer, as well as approved by the state California Department of Public Health. So there are schools that will be opening as early as September 8th in Marin County, and we're confident in their ability to succeed because they've implemented their school site specific protection plan. And that's one of the responsibilities of the public health liaison, is really feeling confident in that you understand the plan that's going to be in place at your school, reviewing the plan with us. We're introducing a new requirement that requires schools to submit their school site specific protection plan for public health officer review. It's not going to be a waiver approval process, but the intention there is that our team of amazing nurses and staff, we have a COVID-19 schools team that consists of Linda Metz, Marcia Grant, Sandra Rosenblum. We're adding more folks, including Jenny Stevens. So a large, and these are names that you might be familiar with because they've already been working in our schools before COVID times, to strengthen our team and make sure that we are able to provide that technical assistance to you before schools open and as schools open. And so this is the email. We're going to be identifying a new phone line that you'll have even more direct access, but at this point, you'll be able to contact us by email as Check Daily, and also have access to public health by this phone number. So let's jump ahead to the next. Oh, the last thing I want to say about the waiver process. So effectively, once we are anticipating on September 8th that we're going to be announced that we're going to be in tier 2, which is a red tier, which if we are able to demonstrate 2 consecutive weeks in tier 2, schools in Marin County will be able to open as early as September 22nd without a waiver. And so that is reflective of the success and the grounds that we've gained in controlling the spread of COVID-19 in our community, and the decrease in the case rates, that as of September 22nd, this is to be confirmed as indicated, to be indicated tomorrow and to confirm no later than Tuesday, September 8th. We're anticipating that schools in Marin County, if we can maintain cases open, will be able to open if as approved by their school leadership and districts. So this is, again, we can control the closures of schools, but public health cannot control the reopening of schools. At this point, it'll be up to individual schools and districts as they implement their plan for reopening. So that there'll be more information to come there. And I saw the first chat question, and it's related to this. We will not require resubmissions of any school site specific protection plans. So our anticipation is that we have to approve those plans for those schools that are submitting for waivers. Any school that's been approved and their plan has been approved does not have to resubmit as we move forward into this new tier. There'll be more information, though. What possibly could happen if we have a second wave of COVID-19 is that we could go back into purple. purple, or that's tier 1. And then schools would be required to have a waiver at that point. So we'll be reviewing that process. Our goal is not to go in that direction, but we all need to be prepared that we could go lose ground on our fight against COVID-19, which is especially critical this weekend. We're entering into another holiday weekend with Labor Day weekend, and that we know increases social activity. And every time there's been a holiday weekend, 2 to 3 weeks later, we see a surge in cases. So there we go.
Hey, Lisa, can I also just add, so on this slide, there is the kind of 24-hour public health hotline for COVID-19 related concerns. But in addition to that, and what's not publicized here, is the specific contact information, emergency contact information for weekdays and weekends. There's both a phone number and an email for public health liaisons. Should you find out at 11 o'clock at night that one of your staff or students has tested positive, you'll have a contact phone number and email once you register. We're not publicly promoting them. It's not for anyone in the public to call. It's just for the public health liaisons. Both site and probably some district level people will have that as well. But again, you'll get that once you register, and Melina will go over the registration process at the end of this presentation.
And
Okay.
I just want to reinforce that number is to be used. We want, part of our primary role is you'll start seeing the scenarios that are presented. You're going to know the scenarios. You're going to figure it out within the first or second time there's a potential exposure. And one of our primary roles is providing that reassurance. So our team really strives to be readily available to the public health liaisons, even if it's you repeating exactly what is said in what is your game plan in the scenario, and you just want to just vet it with us. That's what we're here for, because it's both building our competence and our confidence that's going to allow us to reopen schools and keep those schools open. So you can jump ahead. I think this is you, right? Or is this me?
Yeah. Okay. So we'll kind of tag team a little bit, Lisa. So, this position, the public health liaison, really has emerged, without it being a goal. It's emerged out of necessity based on the experience running these pop-up child care centers in the spring, and then which the success of which led to the spring pilot special education programs. And then this summer we ran our extended school year, both special education and alternative education classes. So, over the course of really 4 or 5 months, we have significant experience running cohorts of students through activities. And in that process, there were multiple, questions that would come up around symptoms, potential exposure, and a potential contact with someone who had contact with. And Lisa and her team just held our hand the whole way. And we were calling every day when we weren't sure. Someone has a cough, should they go home? And along the way, we've always, public health has been very conservative and always erring on the side of caution. And when there was a potential exposure, probably overreacting to make sure that we were doing it right. And we've learned a lot along the way. Go ahead and go to the next slide, Melina. So, this is just the statistics from March 19th to July 31st, our experience to date running small cohorts of youth. And the numbers are right there. I won't read them or all of them, but it's over 6,000 student days of students participating in a program, close to 1,200 cohorts. And in that cohort days, and in that whole time we had 2 cohorts closed because of a positive test, and they were the way that this situation unfolded was that there was 2 students who were siblings who were at separate sites. One was in a preschool, one was in a 3rd grade level program, and they both learned that a family member who had driven them to their pop-up childcare had tested positive. Neither of the kids were symptomatic, but when we learned that, of course, they stayed home until they were tested, and they tested positive, and so we closed the cohorts down. And that was really our one incident And we, we, of course, every step of the way, when we learned about it, we said to public health, hey, we've got a family member with a positive, and they just walked us through every step. And we kind of developed the communication protocols and stuff that we'll talk about later. Is there anything else you want to add to that, Lisa?
I think this is just one of the slides I'm most proud of. It shows that when schools are partnering with public health, that we can keep schools open and keep providing these in-person experiences that are so critical for children. One of the countries that I'm following right now is Uruguay, that now has 70% of their students back in school, and they've taken a very similar approach to us. At the same time, where when we do find the one case that is positive, we close a full cohort, and that is proving to be successful. They've been in school since June 26th. They've had cases of COVID-19. You can't stop COVID-19. It is a virus that's in our community, but you can work to keep schools open by this, again, a very conservative approach to closing cohorts when there is one positive confirmed case in that cohort. And we've also made mistakes where we've closed the cohort too soon sometimes as we're trying to just unravel the potential exposure. And so we've gotten this pretty squared away, and I think this is what's setting us up for a safer school year as we bring us back together in classroom instruction.
That's great. You can go to the next slide. So yeah, so this is really the core of what this presentation is about, is the role of the public health liaison. And again, we've learned it by experience. And the main aspects of it is that you have a direct at a school site as one of the two identified public health liaisons, whether the primary or the secondary. You're kind of the go-to person. So if a staff member or student or family member has a concern, a question, an issue, a potential exposure, they come to you, they explain their concern or their situation, and excuse me, I'm sorry about that, and then you may have the answer to it because you have experienced it, or you say, I'm not sure, let me call my public health liaison, my public health contact, and I'll get right back to you. So you're gathering information, providing it to public health. Public health will say, do this, this, and this, or you can communicate something else. And so the other piece of it is you want to be, you will become fluent with the exposure protocols, which we have a slide for a little bit later. But right now we have 4 specific scenarios that are kind of the most commonly categorized scenarios. And the truth is, every time something comes up, it's one of the scenarios with a little bit of a twist. So there's always little aspects of every scenario that have a twist that aren't necessarily intuitive. And that's why we have public health supporting us every step of the way. And so one of the other critical aspects is when there is an exposure, either a direct contact by a student or staff member outside of the school setting, or a confirmed positive in the school setting, what public health is going to need as soon as possible. And our kind of mark is we think within 15 minutes, you should be able to give the public health team all the information that they would need to begin the step of contact tracing. And so that's a list of all the staff members, students, their contact information. There's some very detailed information that we want to give to the public health team so that they can do their work to help contain it. And so and then of course, maybe the most important thing is when there is an issue or even a concern that's not a specific necessarily a COVID exposure, but something that feels like it, that there's a really open, regular, transparent communication with all the staff and families. I mean, we literally, at the very beginning of the pop-up childcare programs, every time someone had a fever, we would send out a letter, hey, someone has a fever, be careful, pay attention. And then we realized, well, we don't have to send that out just if someone has a symptom, but now, we have template communications for scenario 2, 3, and 4. You don't have to send out a communication in scenario 1, but what we know is that the more communication that you have with your staff, with your students and your families, the more confident they will be that we're doing everything we can to support the health and safety of the school community. Okay, so I'm going to kick it back to Lisa to tell us about contact tracing.
So there's two primary tools for us in public health. One is access to testing. So that's one of the roles that we will be playing. I have a meeting tomorrow with pediatricians, and we'll be meeting again with other primary care providers next week, is to make sure that anyone who has had a known exposure to COVID-19 has access to testing. And that's actually required by state law, that if you are insured, that you need to have access. If you've have a known exposure to COVID-19, you need to have access within 48 hours to COVID-19 testing. And so one of our roles in public health is just helping identify resources for testing. It's not uncommon for us in these investigations that our nurse is actually talking to the family members. Again, a lot of our role is just reassurance and just navigating people to resources. Another thing that you'll see today, there'll be an advisory released, just again, as we're moving into the school year, working with all of our healthcare providers across the county to increase access to testing. So there's additional resources and additional testing technologies that are coming online. And again, access to testing is that first step of early detection. Honestly, most of the cases that we see, the majority of people who have symptoms consistent with COVID-19, and I'm speaking over 90% of those who have symptoms consistent with COVID-19 do not have COVID-19. But what we do need to have is access to testing to confirm that. And then we're also working in the background with the Marin School Nurses Organization, and it's later coming than they'd like, and I appreciate that, but to having a parent handbook. We're reviewing, as Mike was describing, and what I just described, there's a lot of illnesses that look very much like COVID-19, and if there's no known exposure to COVID-19, the likelihood that it's COVID-19 is very, very low. That especially as we're moving down in the prevalence of COVID-19 that's in our community, and that's the direction we're moving in. So we're going to be reviewing and finalizing what are those thresholds for testing. Most likely we'll be erring on the side of caution in the beginning, but as you can imagine, testing, and I have faced this myself multiple times. There is a burden on parents and families who have to get their children tested multiple times for COVID-19. When a parent's gut knows it's strep, we're navigating that space together. So I think that's one of the adaptability and flexibility is definitely going to be one of the roles that we need for that public health liaison. Remember, it's still an evolving disease. It's still called novel coronavirus because it's new. Guidance is going to be changing. Resources will be changing. And so just finding that flexibility. I did see a question pop up. We are seeing less than 2-day turnarounds in testing results, which is very reassuring. Our epidemiology team actually tracks that weekly to make sure that there's no delays that we saw that really threatened our public health response. And I'm not overstating it. In July, when we saw Quest have and individuals who got tested in mid-July have more than 2 weeks go by without having a test result. Access to testing and rapid test results is key. And then your public health department is working to increase access to affordable and more point of care testing options in the community. And that's where, you have your rapid flu, your rapid strep. We're moving toward that rapid COVID test, which again will make life a whole lot easier for families and for schools as we move into the school year. So whereas testing is our first tool, contact tracing is our second tool. And this is, again, where we're going to be erring on the side of caution. We are aiming to create conditions in your schools, and it's not possible. The one case that was a student-to-student transmission occurred in a preschool environment where social distancing is not feasible in a preschool environment. And that was our one case of transmission that occurred. And but for the majority, the largest majority of students and staff returning to school, they never should really meet the definition of a close contact. We're aiming to create conditions where you are wearing a face cover all the time, where you are maximizing the amount of you're maximizing staying more than 6 feet away from other individuals as much as possible, as much as practicable. We do have allowance of greater than 4 feet in some of the classroom settings where children are facing forward and just with desk partitions, and that you're not spending more than 15 minutes with an individual unmasked less than 6 feet. So the conditions that are in our site-specific plan should reduce the number of close contacts. That being said, if there is a positive case, we're going to treat everyone in that classroom as a close contact. That is for the beginning of the school year, and that may change based on as we evolve with this disease. But again, that is us erring on a side of caution where anyone that's in a classroom with a known COVID positive case will be treated as a close contact, even if they wear their mask, even if they never were less than 6 feet away from that known case, and even if they were never in close proximity for more than 15 minutes. And again, that's just for us to err on the side of caution and to keep our schools open. The challenge to that, and we saw this often over the summer, is that it creates a burden for families. So what would happen is that we'll close the cohort. We'll provide an interval. Usually it's 5 to 7 days after the last known exposure to the student or to the staff person to get tested. The majority should all test negative, and that's because they didn't have close contact. The majority should not have had close contact. So we're not going to be surprised when they test negative, but we're still going to require a quarantine for the full 14 days. So it's a very frustrating experience, and we've navigated this. But again, it's going to be a frustrating experience for a parent who has a child who has no symptoms, who test negative for COVID-19, and the cohort is still not opening until we complete the full 14-day quarantine. Again, this may change, but this is the strict measures that we want to have in place in the beginning of the school year to keep schools open. And that's where we'll go into it later. Your documentation is what's going to be critical for us to make sure that we know who was in that classroom. So we really understand that there are other staff that may enter into classroom. There's other staff that may have contact with a quote unquote positive cohort. And so that's where documentation is going to be key for us and for us to be collaborating together with you. So I think we can jump there.
Yeah, and so Lisa, also just to add to that is just that if a cohort were to close, unlike in the pop-up cohort closure, in a school cohort closure for students who were asymptomatic, we would shift that classroom to a distance learning, structure. So in other words, students and staff who aren't feeling sick, they're going to continue their work, but just in a remote structure for 14 days.
And I mean, that's to me, one of the silver linings is and I'll be interested to see as educators as we move forward. My daughter had strep. She was tested for COVID, but she had strep. She didn't miss any days of school because she was able to go to school. And I think that's something that we'll be learning. Some of the silver linings of this is how can we maximize attendance for a child that may be well enough to participate in class and to attend virtual school, but we don't want them in that environment. So I'm just really proud of all the work the schools have done to create virtual learning experiences, because I think it is part of our new reality. And I think it's finding that right perfect blend to ensure access to education. So you should be really proud of yourselves. And then contact tracing, and just to be aware, this is one part of contact tracing where we're going to be depending on the schools just for the school-based contact. If the person who tests positive lives in Marin County, our contact investigation team we've met with them. They'll be contacting that family to do a fuller contact investigation to identify where they might have had other exposures from within their household, other family members that might have been exposed, or other social activities that were part of that exposure. So you're not responsible for any of that. You're really just responsible for the roster of the classroom. Public health is responsible for anything else that is related to that positive case. Okay, so these are, I'm gonna let Mike jump in, but these are our exposure protocols. We've defined 4 clear scenarios where you'll be in partnership with public health. Again, the majority of scenarios will be in scenario 1, where there might have been a known exposure or not. It depends on what we define as close contact, and then an individual gets tested. Cohorts don't close. There's a communication. I think that's 2 I'm describing. Sorry, I'm messing up my scenarios. But there's very before I mess up additional scenarios, there's very defined scenarios that Mike knows better than me in the numbers of how we respond and react. And you already have protocols in place for each of them, and also template letters for communications for each of them to go. So it's really a package deal. So I'll let the expert, not myself, go through those scenarios.
Yeah. So, and I think what I'll do, so, these are on our website, this training and this slide deck will be on our website, within 24 hours, but it's each public health liaison should really take the time to read through each of these scenarios and understand what they are. And scenarios 2, 3, and 4 have a link to a template letter that would go out to family members and all the staff. And what we've learned is, we get a call or an email or a concern, and we listen and we say, oh, that's a scenario 2, or oh, that's a scenario 3. And so the scenario 3 is the one where you have a confirmed positive COVID-19 case. That's the most intense one to be a part of. And so, what we're recommending as the communication is that phone calls are made, that you do a direct, make an effort, every effort from your school site to make a direct outreach to each of the families and explain what you know and what you can. And then there's also a letter. Now, part of this is also confidentiality. There's FERPA and laws about student and staff member medical, confidentiality. So you can only give out the appropriate amount of information. And that's what these template letters have. And every time we've sent out a template letter, it's mainly been scenario 2. You slightly, tweak it because the situation's always just a little bit different. But this will help get you started. The more fluent you are with these scenarios, the more effective you will be both in your communication with your team at the school site and at the district office and with your families, and also with public health. You can call public health and say, hey, Linda, we have a scenario 2. Here's the steps we've taken. What else should we do? And you'll get very quick and direct input. So I think that's all we'll go into here, and we can address further in the question part. I think we're going to pass it to Melina to go over the critical step of record keeping and cohort tracing.
And just to find out, we're finalizing, in addition to the parent handbook, we have, like, you probably remember, like, if there's strep or lice, we have the standard one-page template that's in Spanish and English that can be distributed to parents. So that will be an additional tool that you'll have. And in the beginning, it's going to be reassurance even for those parents. And I think that's where we want to make sure that you feel comfortable and confident to talking to parents. And sometimes it just takes a phone call to us to boost your confidence, and then you're ready to roll. So on to you, Melina.
Okay, Melina.
Our record keeping expert.
Thank you. So Lisa had touched upon how important record keeping really is. So there's basically 2 sets of data that you're going to be keeping. You want to keep it up to date every single day. And then also, I just want to stress, timeliness is key. So that's why you want to keep everything up to date, because when you find out that your first kiddo is a positive, your heart flutters, you get a little panicky, and you say, what do I do? I'm calling public health right now. So when you do that, you're going to call public health, and then you're also going to send along these 2 sets of data to them so that they can start their contact tracing. So the first set of data is contact information, and that's going to be all of their contact information, address, date of birth, their emergency contact information as well. We just think, overkill is probably better in this situation. So all of the information that you can collect and have on hand to send along is going to be really important. Attendance as well. So you're going to keep all of this stuff in organized per cohort and per classroom. So if you have a cohort that you have, maybe a sub that comes in, you want to make sure that you have all of their contact information, and you want to make sure that you have their attendance as well. So as far as attendance is concerned, you're actually going to want to send about 10 school days prior to public health with that contact information. And the reason they want that is because they really want to be able to see the person that's positive when the last contact was with the rest of their classmates, teachers, subs, whoever else ended up being in contact with them. So those are those two sets of data, and we'll go over two samples of each in a moment. But I do kind of want to talk also about kind of collecting that information. So as far as contact information, sending out a Google form is really kind of key, especially when you're collecting a lot of data, because it puts it into a spreadsheet automatically, and then you can just format everything from there. As far as attendance is concerned, you can also use Google Forms, which are surveys, for their check-in as well. So that kind of goes into a spreadsheet automatically, and you can just format it from there. As far as tracking is concerned, you can use spreadsheets, or you can also use your attendance software, something like Aries, and I'll show you an example of what that looks like in a moment. Again, I want to say timeliness is key, and again, that's why you keep everything up to date all the time, so that you can send all of that information organized off to public health so they can start making their calls for contact tracing right away. So this is the cohort tracker that we used for the pop-up model that we started at the end of March. So basically what we would do is we would just call each site and say, hey, this is cohort information. So for this, this would be taken from their emergency sheet, and somebody put it into a Google spreadsheet. So we had all of that information ready to go. And you'll also want to have your student and staff information in the same document so that they know that that is all together. This is pulled from Aries. So this is another option that you can do. So it doesn't look as kind of formatted as the Google spreadsheet is going to look, but it has all of the contact information, and all information was taken off. So this is not actual students. But as you can see, per student, it's going to automatically organize it by classroom and by teacher. So it has all the information there, and if you can just download that report, you can send that off to public health as well. So what I would do as the liaisons is work with the people that might be kind of collecting all this information. Maybe it's an administrative assistant or a secretary that's actually going to kind of be doing the legwork. Get with them, look at your attendance software, and kind of see exactly what's going to work the best for your situation. Next up is attendance. So as I said before, what we would do for the pop-up model is we would call each classroom and say, which kiddos are in class today? And we would just put in X, and then we would be done. We would have this all up to date by about 11 o'clock each day, so that we wouldn't have to worry about anything if there was a positive, and you have to do this kind of mad scramble to kind of figure out which kiddos were in the classroom on which day. And again, you want to make sure that your student information and your staff information is all up to date within the cohort or classroom. And then this is also from Aries, and this is the weekly attendance report per classroom. So you can see there's 8 students in this class, and any kind of mark here means that they were absent. So any blank boxes means that they were actually there. What I did is when we started working with these Aries reports, I took screen captures of all of them, and then I sent them off to one of the nurses. I think I was talking with Marcia Grant, and she looked at everything and said, yes, this is absolutely doable. So feel free, once you kind of have the number that you can call and the email address, to kind of reach out and just touch base and say, hey, this is what we're thinking. Is this going to work for you guys, so that you guys know what to do moving forward? So next up, I'm going to talk about the liaison registration. So we will, I believe we sent out a link to all of the school leaders for this survey. So this is just the actual primary and secondary liaison information and contact information. We're going to create a big database, and then we're going to take all these emails, and we'll email you guys the contact information for public health, as well as the weekend information that was just set up, so that you know how to contact them. And then when you register, obviously they'll have all of your contact information. So should there be something that they hear about at your school, like a positive case, then they can always call you and say, hey, we heard that this was happening. And there's back and forth communication for that. So again, if you guys can, we'll throw that into the chat box in a moment, the link for the registration. And again, please register so that we can get you all of the new contact numbers and the weekend numbers as well. And then I just wanted to do one more reminder. Don't forget about your SSSPP. Start working on that. Please make sure to go to the Rethinking Schools website. We have 3 different versions of this. We have Adobe PDF, we have a Word version, and we have a Google Sheets version. So we're hoping that at least one of those is super accessible for you and the way that your office works as far as filling all of this out. So definitely start working on that because you will need to submit that very soon. So that's all I have if we want to take some questions.
Okay, thank you so much, Melina. And I know that there's been questions that have come up in the chat box, and I'll address a couple of them. One that came up is for contact tracing, what's the guidance about teachers moving between classrooms, such as specialists like world language or music teachers, and what about siblings in two different cohorts?
So siblings are treated, if there's a positive sibling or the other child or a child who's considered exposed, we pull both children from both different cohorts. This is again erring on the side of caution. We've done that before. Both kids have tested negative, and then they stay home in quarantine, and then we don't have to close that cohort. So again, the sooner we can find out there's a possible exposure, that helps us be more proactive in pulling students or pulling a potentially exposed staff or student out, and that allows us to leave the cohort open. So that's the sibling part of that question. And then there was, the student. So this is where it does take a public health consultation. So we do have staff that we know that float from classroom to classroom. Again, the goal of reopening is to try and minimize that as much as possible. This is where we'll just have a phone call with you as a liaison, identify if there was any possibility of true close contact with that staff or teacher that might have been floating, and then make basically a case-by-case determination of whether that individual needs to be part of a quarantine, or if that individual can continue to work wearing a face cover and monitoring for symptoms. So those are often our two decisions. In most cases, in that situation with staff, we have allowed staff to stay on campus and continuing to work, wearing face covering, monitoring for symptoms, because we're not identifying true close contacts. That will evolve as more services come. This is probably one of my common jobs on different employment, like it could be from police officers and first responders, is really trying to find the nature of the contact of a confirmed positive case. And so as we have speech therapy and occupational therapy and other individualized services that are coming on board, we might have different decisions regarding what their exposure might be. And it's generally erring on the side of caution, especially as we're aiming to reopen school. I saw one of the questions that also came up around closures. So there is a very defined, the state did give us guidance in the state guidance documents on reopening. It also gave us guidance on closures. So they have set, I have so many. So when we do these presentations, we have to have many windows open because there's many different guidance that's out there. But when there are multiple cases in multiple cohorts, or when at least 5% of the total number of teachers, students, staff are cases in a 14-day period, that's when we would be recommending closure. So again, if you may remember, and I've said this probably a couple times, I'm sorry for repeating myself, in the beginning of this, in March, when we're trying to keep schools open, our plan was one case, the entire school shuts down. That's different now. Now it's one case, a cohort shuts down. But we will be, again, that's where education and monitoring for symptoms and the communications you have with family, et cetera, is to prevent there from being another cohort that becomes positive. Especially remember, as things are reopening, there may be children that, for example, are participating in a youth activity. So the exposure came actually from their participation in a youth activity with other students that might also attend your school and attend different cohorts in your school. So that's as we're reopening, some of the work will get a little more complicated. You're only responsible for knowing what's happening in your school. We are here to figure out all of the other stuff.
Yeah, and there's a question here, Lisa, for smaller schools, if 5% of the school's positive, all in the same cohort, does the whole school still shut down?
And not necessarily. This is where we're going to take it slow on a case-by-case basis. Those type of decisions, it'll be Linda, Marsha, me, and Dr. Willis all talking together when there's kind of more special circumstances, and to determine if what's the best decision. And again, we understand we're under a lens right now. We're reopening, and we know we're trying to cross all our T's and dot our I's and making the best informed decisions to keep these campuses safer. Again, going back to my favorite slide, we only had to close 2 cohorts. That means there are thousands of student days that continued. And so that's by being a bit more proactive. We know it can, being a little bit more aggressive might adversely affect some, and being more conservative might adversely affect some, but overall it's going to keep schools open.
And Lisa, this one has come up, I know, in the past multiple times, but I feel like the more that we address it, kind of the more helpful it is to our school community. So this is speaking to the middle school and high school models, where you have bigger cohorts made up of multiple classrooms, and teachers are teaching multiple classes, within a cohort, say, have 100. So it might be 3 or 4 classes of students that are in that larger middle school or high school cohort. If there was a positive case in that setting, would every classroom within that cohort have to close likely?
We would have to really look at the classrooms and exposures. This is going to be our more complicated picture. As you've seen nationwide, this disease behaves differently in the 10 and under, the elementary school population, than it behaves in the adolescent population. So it's possible or even probable that high schools might be or middle schools might be our first school closures because of just the nature of higher level of connectedness. And again, that's where our role is really working with the students and parents and staff in those environments to really try and emphasize the need to follow all of those protective behaviors that are in place. But this is where the attendance records and us getting and communicating with us, so we can literally see, well, this science class had John Doe went through science class, math class, English class, and then we'll be tracking that and then quarantining those classes, and then ideally trying to limit the closure of other cohorts. It's going to be complicated. We're going to work with you together. We're going to learn a lot, again, how to do this. We're also looking at technology. I had a meeting with some awesome students who already did something I never could conceive of doing at their age, of developing an app and making sure. They told me it was HIPAA compliant, and they're 17 years old or 16 years old. So we're going to be looking at technologies that have potentially been developed by students for students at having self-reporting, because we know that's the other phenomenon is the school, as much as it might not feel controlled sometimes, the school offers the most controlled environment for our adolescents. And we know there's a lot of other extracurricular activities where there might be less social distancing or reported relationships where they might be having really close contacts with people that might not be in their cohort. So we're working again to optimize the engagement of students in developing plans for contact tracing, so there might be more willing to report, because our goal again is to keep schools open. So we'll be looking at that too. But it's good that will be one of we had the simpler work was behind us. The more complex work will be ahead of us.
So this is another topic that has been an evolving discussion and changing guidance. Are we no longer required to take a child's temperature?
No, you are no longer required to take a child's temperature, nor does the public health department recommend you take a child temperature. The temperatures are very, very variable, especially as we're getting heated up. There's a lot. My daughter failed 2 times after biking to school in a hot days. Temperatures are not the most reliable predictor of COVID-19. What we are recommending is a screening of staff. Staff need to have their screenings completed, not temperature. I think it's an online screening of reporting symptoms and confirming that they're not coming to campus with COVID-19. And we are educating parents around home screening and making sure that they are not sending a child to school who may have been exposed to COVID-19, because you would be surprised by the number of cases of COVID-19 when people really do know they had a known exposure. And often denial is a strong part of our human condition, and deny that exposure really could result in COVID-19, and it does. So we're going to be working hard to educate parents on their role of screening in home and not sending a child who may have had COVID-19 exposure to school, and is not presenting with symptoms yet, or sending a child to school with a fever or symptoms consistent with COVID-19. And that's going to be, again, an evolving space for us, but we really are going to be depending on parents for that. And again, thinking small, where parents are educated not to have a lot of mixing of other households. That's what's going to, again, create the spread of COVID-19 in the school community, is the more that parents and families mix households, that's not going to create the conditions for keeping us in school.
Thank you, Lisa. And just to add to that too, what we've done, in the build up and preparation for our special education classrooms and alternative education classrooms that will open on Tuesday, September 8th. One of the requests that we had from our teachers is, can you give us something prominent and visual about symptoms that we should be looking for in our students and ourselves? And so there's some great CDC, and probably Marin HHS has some too, the symptoms of COVID-19 and what you should pay attention to and go home until you're tested or your symptoms resolve. So let's see, are there any, we have a few more minutes left here. Let's see, are we calling, so Lisa, you clarified, there was a question in here, I can't find it right now, but you mentioned that the communicable disease public health letter will be something that you're working on and will get out. So in other words, there'll be a template letter separate from our template letter. You're going to have a public health communicable disease.
Exactly. We want the hand print on it, the friendly language to the parents, and the reassuring term. We're finalizing that. It's later than, everything's later than what we want it to be. And again, I'm just to be transparent, we are meeting with the primary care providers tomorrow and into next week about really trying to clarify the algorithm for testing, and just wanting to get and Dr. Willis's final approval of that algorithm for testing. For example, the symptoms, if you look at the symptoms for COVID-19, allergies can match what COVID-19 looks like. And I'm sure a bunch of people had lots of allergies and smoke and inhalation issues this past week. And our goal is to be conservative, but then also not to err on the side where children are being sent home with a scratchy throat and they have a known history of allergies. So we're trying to finalize that information. I apologize for the delay. There's the fires kind of delayed our COVID-19 planning and response. So my apologies there.
So if a child is sent home with a fever, you're forgiven, Lisa.
Thank you.
If a child is sent home with a fever, what is the responsibility of school? Can they require a student to get tested?
I don't think schools can't require them to get tested, but they certainly can not allow them to come back. And I think that's why we're trying to get the guidance finalized there, because it's gonna become a frustrating, I think it's gonna be a frustrating space. That why we're trying to get our language right the first time and being as clear as possible the first time, because, and I dealt with, like I said, I dealt with myself. It's a frustrating experience and I had relatively easy access. My husband actually does Kaiser's testing for COVID-19. So I have a swab in my house, and that's privilege. And so I think of myself and other privileged families who have access to testing, and we want to make sure there's equitability there. And so we also want to make sure we have a very clear clinical decision tree that makes sense from a common sense perspective, but also makes sense from an evidence perspective. And that's the gray space right now. There's not a clear, perfect algorithm from CDC that says the child with the stomach ache doesn't have to get tested for COVID-19. And that's what we're trying to develop, that's approved at least for Marin County Public Health.
Yeah. And there's more along this line. There's a question about a notification form for districts to use when employees test positive before we have students on campus. And so that kind of is a combination probably of the public health letter, but also the protocol communication. Hey parents, we wanted to let you know that, and it's probably a student or staff member has tested positive. Public health is taking steps to identify and quarantine those who have had close contact. We'll provide you further pertinent information. But that's kind of a combination of the template letter that we have and the public health letter on top of it. Okay, so what other questions here? A couple more here. What about the office protocol? We always have exposure to most students and staff. What is the thought around limiting this exposure? We need to include the office staff to each of the spreadsheets in case they're sent to the office and office may be exposed.
And I think this is where I'm making sure schools now, I mentioned it earlier, just like vaccinations, everyone's required to have their vaccinations before the start of school, which did start in August. So any parents that haven't submitted their vaccinations are delayed in getting their vaccination records in. Our expectation is the school site-specific protection plans have been completed and reviewed with staff so you can have those considerations. And I think that's where your team is kind of walking the campus as if and figuring out, and schools that have already submitted the waivers, I know have done that. How will people be moving? How will we operate differently in the office in order to minimize contact? And there's changes that you guys are much better suited to figure out how to minimize those face-to-face contact and really limiting that. And I think that's where we look to you guys to develop that plan, that protection plan that really thinks of the special dynamics, or moving people around and that flow of students, of bringing the sick child into the office, and where do they go when you also have the COVID child. So there's things that really have to be done on that school site level, and with the goal of maximizing protective behaviors and minimizing close contacts with all students, and knowing that there's some students you need to hug. And I think that's where I just want to, this is not, and I've seen some great pictures of some of like students picking up, and clearly some teachers breaking the 6 feet boundary, and that's allowable. We want to start creating a safer environment. We're doing everything that we can, and some kids will need a hug. We don't want to create pure 6 feet spaces at all times. It takes, even if you hug a child, you can wash your hands and do other things to make sure that that child, that if they were to be infected with COVID-19, you're not getting infected yourself. So this is us working together, trying to balance common sense, compassion, and science together. And we'll do it. We're going to get it done, and we're going to learn together, but it's going to be challenging. So I recommend everyone look at that school site plan, make sure you've had an opportunity to flesh it out with your staff. And that's why we're here to review it and to provide any guidance, technical assistance that we can to make sure it works.
Yeah, and what I'll say too is just internally, and we haven't, publicized it or promoted it on our website, but we have had to, in our own MCOE office setting, we've had to refer to the exposure protocols for schools when concerns have emerged in our office. We have about 75 people working in our office here every day, and so when there's a potential exposure here, the template letters or the template steps don't really relate to the office setting. It's really a school-based exposure protocol, but the logic and the guidance from public health remains the same. So even though we don't have cohorts, we have close contacts, and we work with public health to identify any potential concerns, or if there is a need for someone to need to quarantine. And the other thing that I'll say about testing is, in the guidelines, there's a specific guideline focused on staff testing before first contact with students, and then on a 2-month rotation at least after that. And that's something, again, that we can't require, but that we feel is in everyone's best interest to do to support the safety of the school community. So,
Can I just add one thing around testing, and it came up this one of the last chat questions. The testing technology is evolving so rapidly. The test that most of you, if you've been tested, or that individuals who've been tested in Marin County have been tested with, is a specific viral detection test called a PCR test. That's very, very sensitive and can test and can find the smallest amount of viral DNA, even if that person isn't contagious anymore. And so what we're shifting to, and this is the challenge of COVID, what we're going to be shifting towards is something called an antigen test, which is much more specific if someone is actually contagious, because it's detecting the antigen that's a protein that's on the virus itself, rather than just a piece of a particle. And so that's one of the challenges right now where we're seeing, for example, a lot of asymptomatic people and everyone testing positive. It's why we don't recommend retesting, because we've seen since the beginning, we called her the Diamond Princess. It was the first patient that landed in one of our hospitals. She tested positive for COVID-19 for 3 months and had 2 federal officers guarding her because we're still in containment mode. And she was not infectious and she was not contagious. And so what you're going to see, and it's going to help us stay open, is new testing technologies come in and to support us. But I think that's just going to be the challenges of us working together with this new virus and new technologies.
All right, so we have reached the end of our training. We really appreciate everyone's participation and your questions, and we know that we still are in an evolving situation and more questions will come up. Our Rapid Response Rethinking Schools team is here to help you however we can. Please register as soon as you can if you're one of the identified public health liaisons, and we will continue to feed you updated new information as we receive it. And thank you so much for all that you're doing to support the health and safety of our student, staff, and larger community. And thank you, Dr. Santora, again for your help every day.
Thank you, and thank you, everyone. And really sincerely, from the bottom of my heart as a parent, I appreciate the time that you invest on these calls. You have been working since February with us, and we're going to get there. We're going to get there together. We're going to learn. We're going to readjust. That's what COVID makes us do. But thank you. I really value your time.
Bye, everybody.